Gallstone pancreatitis refers to the inflammation of the pancreas as a result of blockage at the pancreatic duct by a gallstone. The pancreas is responsible for the production of enzymes and hormones essential to the digestive process. But how do we get this disease? In most cases, gallstones are a result of the liver producing too much cholesterol because of a poor diet, alcohol, along with physical inactivity and obesity. The gallbladder functions as a reservoir for bile, which is delivered to the duodenum in response to meals. Increased cholesterol in the liver ultimately forms crystals in the bile of the gallbladder, creating these gallstones. In the case of gallstone pancreatitis, the stones leave the gallbladder and get lodged into the common bile duct. However, these stones can further block the pancreatic duct, which is the opening of the pancreas to the first part of the small intestine, the duodenum, and thus cause pancreatitis. This usually occurs at the level of the sphincter of Oddi, a round muscle located at the opening of the bile duct into the duodenum. This is increasingly problematic, as gallstone pancreatitis can cause digestive fluid from the liver, gallbladder, and pancreas back into the body and cause an infection known as cholangitis. Additionally, the tissue of the pancreas can begin to die off in a condition called pancreatic necrosis. Thus, gallstone pancreatitis and these associated conditions can lead to symptoms such as chills, fever, jaundice, nausea, pain in the left upper abdomen, and vomiting, among other signs. The most common diagnostic tools for gallstone pancreatitis include different types of body scans and blood tests. Blood tests can identify the inflammation in the pancreas in addition to evidence of obstructed outflow of bile from the liver. CT scans, MRIs, or ultrasounds can produce a clear image of the severity of an individual's pancreatitis. These scans can also illuminate whether there is a need for surgery to remove the gallstone altogether. The main form of management is by having a healthy diet, maintaining a steady weight, and taking care of cholesterol levels. However, treatment is crucial as the disease is life-threatening if left untreated. Initially, treatment is commenced by avoiding any intake of lipids and solids until the inflammation subsides. Intravenous delivery of fluids is usually all that is required if the inflammation is mild and symptoms resolve within a few days. Severe nausea and vomiting are treated by relieving the stomach of fluid by the use of a nasogastric tube and with anti-nausea medications. In severe cases, a surgeon will likely remove the gallstone through a surgical procedure or an endoscope after discussing this with the patient. This is typically done after 48 hours of administered fluids to allow inflammation to ease first. Removal of the gallbladder itself may be advised to prevent the disease from happening again. By staying informed and seeing the links below, you can better manage your lifestyle and prevent gallstone pancreatitis.